Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, some of the highlights. Today, 226 new confirmed cases of COVID-19 recorded in Nigeria and 1 death, bringing the total number of cases to 6,401. No new state reports a case in the last 24 hours. Zamfara state government disputes confirmed cases of COVID-19. And infections climbing high in Brazil as daily death toll jumps. Now, at a time when the country contends with the devastating effect of the coronavirus spread, with different sectors of the economy at the brink of closing and others simply holding on, one thing is certain: accelerated response to COVID-19 should include unprecedented programs to develop a vaccine, research into potential pharmaceutical treatments, and strengthened channels for information sharing between countries. The National Assembly, obviously worried about the rising cases of COVID-19, is demanding a comprehensive report on the state of medical research and manpower capacity in the country's health institution. Where are we on that? Well, on the program, we look at efforts to accelerate diagnostics research for a solution and therapeutics for this novel coronavirus. In the meantime, the total number of confirmed COVID-19 cases in Nigeria is now 6,401 after latest announcement with 226 cases yesterday by the Nigeria Center for Disease Control, NCDC. The new infections were recorded in 15 states and the Federal Capital Territory. Till date, 1,734 patients have been discharged and 192 deaths recorded in 34 states and the FCT. A breakdown of the figures by region shows Lagos in the southwest with the highest number of cases at 2,755, followed by Kano in the northwest, 842. In the north-central region, the Federal Capital Territory has the third highest tally with 427. Borno still tops in the northeast with 227 cases. Edo leads in the south-south with 119 cases. Enugu in the southeast with 16 cases. And over in Zamfara state, the government has kicked against the number of new confirmed COVID-19 cases that was announced by the Nigeria Center for Disease Control, NCDC, for the state on Monday. The Commissioner for Health in the state, Mr. Yaya Kanoma, told Channels Television that the state recorded only 2 cases on Monday, May the 18th, and not 10 cases as confirmed by the NCDC. He also said that the state government has informed the Center for Disease Control about the error, asking that it be rectified immediately. Mr. Kanoma, however, laments that in spite of the assurance by the centre through its representative in Zamfara to correct the error, no action has been taken in that regard. Over in Adamawa State, in response to a directive by the presidency to state governors to consider certain categories of inmates for release from custody to prevent transmission of the coronavirus disease, about 173 inmates have been released from the various custodial facilities of the National Correctional Centres. This was made known by the Adamawa State Attorney General and Commissioner of Justice while briefing the media in Yola, the state capital.
The committee commenced this exercise of decongestion of correctional centers on the 4th of May 2020 and has visited all the custodial facilities with domiciled inmates in the state. Consequently, from all the custodial facilities visited by the committee, 129 persons were released from confinement, while 44 were granted bail, making a grand total of 173 number of inmates that benefited from the exercise.
The purpose of this exercise is with the view to see that the number of inmates in the correction centers are reduced or at some extent taken care of, so that the spread of the COVID-19 in the sense of the experts can be minimally controlled, because the more you put people together, according to the professionals, there's a high tendency of the escalation of the pandemic.
Let's now dissect some of the solutions to COVID-19, and joining us from Abuja is the Director of Food and Drug Services, Federal Ministry of Health, a pharmacist, Mr. Moshood Lawal. Thank you for joining us. Also via Skype, we have Kudirat Lawal Adeshino, a senior radiographer. Thank you again for joining us.
Thank you.
Thank you for having me.
All right, let's start with you, Mr. Lawal. How can we accelerate innovative research to help in contain the spread of the epidemic and facilitate care for those affected?
Well, thank you. The world all over, efforts are on to ensure an accelerated research into the discovery of cure or even understanding the coronavirus itself. Because by the name, it's a new strain of the coronavirus. So the world is just understanding it. And researchers all over the world, including Nigeria, are doing tremendous work to understand it. Also on the treatment. At our own hand here, we have our universities. And specifically, we have two key institutions at the Federal Ministry of Health. The Nigerian Institute of Medical Research in Yaba, at the Yaba bus stop there, and the National Pharmaceutical Research and Development Institute, the National Institute for Pharmaceutical and Research and Development at IDU in Abuja here. The two of them have been working silently, as scientists will do, to ensure that we find solutions and contribute to the global effort to ensure that we unravel the virus itself, and through that develop measures to treat it and contain it. So for us to move ahead, research involves a lot of resources. Human and material resources are required. And it can go on for years, even despite the efforts of the world to accelerate the research in this area. So we need to put in resources and get ourselves more organized, and we are doing that. The government has set up an advisory committee headed by a renowned virologist in this country. And our research institutes, I mentioned, they have been put on alert, they are working. And I'm aware that resources will be made available to them to ensure that they, as a group and as a nation, we contribute to national and global effort. Thank you.
All right, let's talk to the senior radiographer, Madam Lawal Adeshino. Now, in your field of radiology and CT imaging, what would one expect to see with a case of COVID-19, from severe to mild cases to asymptomatic cases?
Thank you very much. With respect to radiography and COVID-19, there is a lot of role that imaging has to play here. For instance, the PCR testing, we all know that at the moment, the result takes a while to come out. So imaging has a role in the sense that, for instance, chest X-ray, plain chest X-ray imaging is very accessible and the result comes out quite promptly. So we can use chest X-ray, which is going to be carried out by a radiographer, to make initial diagnosis. And this will help us in quickly isolating patients that will require isolation. Also, another imaging modality that is very useful when it comes to the diagnosis and management of COVID-19 is ultrasound. Where ultrasound imaging comes in is in the triage of patients. When patients arrive to hospitals, we can quickly scan them. Ultrasound is another equipment that is readily available. It is not expensive. We can get them in our hospitals. We triage patients with them on arrival. When we do this, we're able to quickly identify patients that are potential candidates for COVID so that their pathway will be different from the pathway of other patients so that we reduce the risk of transmission in our hospitals. So chest X-ray and ultrasound are very useful at this stage of diagnosis and management. However, with CT scan is particularly useful in monitoring response to treatment. In Turkey, for instance, in the management of COVID, and it has proven to be very, very useful. So this is another advantage in imaging technique with respect to COVID-19.
Also, with regards to what you do, how much precautions do you take to limit contamination between patients and then other patients and perhaps professionals like yourself?
Right. There are two major things here. The first one is to ensure that on arrival, if we can get patients scanned, ultrasound, with the practitioner fully equipped with their personal protective equipment, that is their PPE. Practitioners asked to be provided PPE so that they limit direct contact with patient, because there is no way you can perform any form of imaging modality without touching a patient. So here, PPE is quite vital. So one of the measures we take as radiographers to protect ourselves from infection and also to prevent transmission of infection is to don adequate PPE. Another measure is good communication between the referral and the radiology department. Here, if we get information that a patient with possible COVID-19 is coming to the department, what we need to do at that point, what we do in the radiology department, is to ensure that we prepare for the arrival of these patients by preparing the room, covering our equipment properly, and then following the examination of these patients. When they leave our department, the radiography department will wipe and ensure we disinfect our equipment. But however, having said this, ideally, like in Nigeria, there are isolation centers. Ideally, a dedicated portable X-ray machine should be available in our isolation centers. So they are dedicated specifically for those who have confirmed infected. But in our main hospitals, we will have to follow pathways where we separate potential COVID from non-COVID, and then we follow disinfectant protocol after examination of patients.
Right. Let's quickly find out from Mr. Lawal, and you talked about the procedure with regards to research that is ongoing, but a lot of people would also want to know how long will this research take and when will we see the results, and if, you know, we've been told everything would go through screening, when can Nigerians begin to, with this information, your research updates be made public?
Thank you. As I said at the beginning, research is a process that takes time. No matter how eager the world is to get a solution, we must not forget that we have to be very, very careful with research, especially on things to be used by human beings. The world took notice of this in the early 60s with the popular thalidomide issue, when we had adverse reactions. Children were being born with one limb or without one limb or two of them. And that made the world to pay more attention to ensuring that proper steps are taken in research, especially when we want to develop a new medication. It is important, while we wait and hope we get results on time, to ensure that we follow strictly, no, there's no negotiation about it, that we follow the laid down rules and guidelines. With concerted effort of the world, being coordinated by the WHO, the World Health Organization, it is hope in a not distant future, something positive will come out. But as I said, as much as we want quick results, we cannot ignore laid down rules and regulations for the safety, so that we will not be substituting coronavirus with another self-inflicted ailment through the use of not properly investigated medication.
All right.
Thank you.
Thank you so much.
So one cannot be specific on the exciter.
All right. We appreciate your time, Mr. Moshood Lawal, a pharmacist, Director of Food and Research Services, Federal Ministry of Health. And also, we'd like to thank you, Madam Kudirat Lawal, additional senior geographer. Thank you both for joining us on the program.
You're welcome. Thank you for having me.
We have more on the COVID-19 updates when we return. Let's now jet to Bayelsa State, where our correspondent, Dobra Timiwood, brings us this update.
The Bayelsa State government has announced an extension by 2 weeks on the closure of the state border and a daily curfew in the state. Now, the curfew starts by 8 p.m. and it lapses by 6 a.m. daily. Yesterday, Bayelsa State received a not-so-cheering news regarding another case of the coronavirus. This time, a medical doctor who is alleged to have traveled to the neighboring Delta state. Now, the COVID-19 task force in Bayelsa State says it's expecting a cheering news later on in the day as a second test has been conducted on the other COVID-19 positive patient in the state. Now, the patient is said to be without symptoms and every contact he had interacted with has also been tested and all their results have come out negative. The results for a second test is expected later on in the day and they are hopeful that it will be negative. These are the updates from Bayelsa. From Yenagoa, Dobra Timiwood.
Over in other states, we begin in Ogun, where 4 middle-aged men have been arrested by the Ogun State Command of the Nigeria Security and Civil Defense Corps for violating the interstate restriction and use of face mask directives in Abeokuta, the state capital. The state commandant of the Corps, Mr. Hamid Abodunri, said the violators, who are residents of Katangora in Niger State, claim to be on economic and survival mission in the state capital. He sounded a note of warning to others to refrain from violating the law, as the suspects would be tried by the state's mobile court to determine their culpability or otherwise. From Anambra State, leaders of communities are raising concerns over infiltration into the state by strange persons who are from high-risk areas of coronavirus infection. They insist that not only are the lives of community members at risk, they also say those persons are clearly violating the federal government's ban on interstate travels and must be stopped. Over in Yobe State, the government has asked residents to partner with authorities and take responsibility of their health by wearing face masks willingly to curb COVID-19. According to Dr. Lawan Ghana, who doubles as the Health Commissioner and Vice Chairman COVID-19 Committee on Prevention and Control, he adds that there will be no penalty for the violators of face masks, but is adopting a amicable way of influencing the public on the relevance of using face masks in public. He disclosed this after meeting with directors of personnel management in 17 local government councils of the state, also saying that the state will soon take delivery of a PCR machine and is also working with the NTDC to establish a testing center in the state. And it's back to work, says the governor of Niger State, Abubakar Bello, ordering all contractors handling projects in the state to return back to site and continue their work. He said in spite of the challenges posed by COVID-19, life must go on. He has also warned that any contractor who is found not working in line with the specification of their contract risks having their contract revoked. Well, joining us with regards to ways we can stem the COVID-19 pandemic in Nigeria is a psychiatrist, Dr. Aino Ikomi. Thank you for joining us.
Well, thank you for having me.
So let's talk about coping with the new normal, especially children. I mean, it's no longer early to bed, early to rise for them, is it?
Yes, it's very clear now that corona pandemic has caused a massive disruption in the old normal, and it has led to the pervasive changes in all areas of our lives: your personal life, your social life, academic, school, work, social, entertainment, even religious lives. So because of these changes, these pervasive changes, it tends to bring out so many negative thoughts and emotions. Now, the problem with children is that they are still developing mentally. And because their mental systems are still so fragile, if nothing is done constructively, it can damage their mental development. It can even cause them to develop into what we can call like a psychologically stunted, mental growth, something like that. So it is very, very important for parents and caregivers, and when I say caregivers, I mean anybody that has anything to do with children, to know that these children are also in danger of adverse development. They are not bystanders, as a lot of adults might think that, oh, they are children, they should be playing, and after a while they are going to forget about all this stress. It is not so. It is not so. All these experiences and changes will go on to build their psychological profile and act as templates in future stresses. So parents and caregivers need to know that even though their mental systems are fragile, the same fragility can also be taken advantage of, because children can soak up so much things. I mean, right now, they can acquire so much skills, they can acquire so much competencies to deal with stresses, even better than adults. You know.
I was also going to ask, because, so we still have some parents who are staying at home, so they're working from home and they're also taking care of children. And
yes.
In some ways, it's challenging, isn't
yes,
it?
It is, but you have to combine the two. I mean, it's parenting is not play, is not joking, it is effort, So you have to make a calculated attempt to help your children, because they are your future investment. So what can be done? I just want to mention like 3 things, because the brain is the organ of adaptation and achievement. The way you model a child's brain will determine how far that child goes in life. So what are the 3 basic things that you can teach children? Number 1, I want to talk about positive emotions. Number 2, stress management. Number 3, cognitive restructuring. So let me talk about positive emotions. Like, because of these changes, it's likely that a lot of times we and children would always be in a state of negative emotions like fear, anxiety, worry, and because of the uncertainty, there's so much negative emotions. Now, you can teach children to deliberately evoke and deploy positive emotions. Like, for example, you can teach them how to deploy the emotions of joy. So instead of feeling frustrated, maybe when they go back to school and they are waiting in line to wash their hands, because the new normal is going to be very inconveniencing, it can be frustrating. So instead, they are waiting in line, instead of, when is it going to be my turn, they can just begin to remember those things that gave them joy. Like remembering how when they interacted with their friends and the stress management. Let me mention stress management. Okay. Stress management, that we can teach children, very, very cheap, like deep breathing. It is a powerful stress buster. Deep breathing, like maybe inhale, exhale for like few minutes, few seconds, it helps. And then mindfulness, focusing on the present moment, to the exclusion of all the chaos in the environment, can bring your body back to normal. And then the last one, cognitive restructuring, is having multiple perspectives on things and not just being tunnel vision. And it will help them to see opportunities and challenges. And when like these 3 basic things are done, these children will grow up to be very, very psychologically resilient, and their best potentials will be realized.
Thank you so much. Thank you for having me. Dr. a psychiatrist. Thank you for joining us. Well, health experts in Brazil are indeed wary of the true figure in the country, as they say it may be far higher due to the lack of testing in the country. In the past 24 hours, a further 17,408 cases and 1,179 deaths have been recorded. They fear the outbreak could overwhelm Brazil's health system in the coming weeks if cases continue to rise. Brazilian President Jair Bolsonaro has repeatedly downplayed the threat of the coronavirus, criticizing governors and mayors for adopting strict restrictions to curb its spread. This comes as the global death toll from the disease surpasses 323,000, with the number of cases almost hitting the 5 million mark. From the NCDC, take responsibility in protecting your health. It says the virus that causes COVID-19 can spread by touching a contaminated surface and then touching the face. So please avoid touching some of these areas, door handles and stair rails as well. The website has loads of information. Also, the World Health Organization, physical distancing is one of the most effective methods to limit the spread of COVID-19. The website has rolling updates on the pandemic epidemic. Our website, channelstv.com, has the latest news. All you need to do, log on, access news in health, politics, business, sports, Africa and around the world, all at your fingertips. Well, that's our COVID-19 update program. Thanks for watching. Another update comes your way again at 6 p.m. Until then, I'm Minister Ntwaka. Stay healthy and stay safe.